Thank you for inviting me here, and thanks for the kind introduction. I'm here on behalf of the whole team, of course, of co-leaders from Norway, and not least Sarah Bengtsson, who I personally consider more of a leader of this work package. But I will give the presentation, and then we can have a lot of questions during the panel discussion afterwards. So, our first, the task 5's main outcomes will be discussed during this presentation. And there were 3 work packages. So the IHR strengthening in countries, cross-border collaboration during crisis, and simulation exercise and after-action review assessment. These were the 3 different work packages. And the first one were by us, and the other 2 by the Norwegian colleagues from Folkhälsoinstitutet and the National Health Agency. So in the work package we had several countries participating, and 12 of those were considered focus countries, that and those were countries with lower, considered a bit arbitrarily lower income countries that had maybe joint challenges towards the others. So we wanted to focus and make sure that they got assistance in strengthening. And then for what we wanted to do was to improve the IHR implementation in these countries by selecting core capacities. Out of the whole list that you all know, we wanted to select some so that we didn't spread our work too thin. And we did this by having 3 workshops and the plan was to use a tool in between and do some more work. We did baseline analysis, we had checkpoints, and then of course a final analysis to make some conclusions. However, the pandemic struck and we had to change the plans quite a bit. So I don't think that much work was done in between the work packages as planned, with the purpose of moving this work package forward. But a lot of work was still done for improving preparedness, which you will see later. So although the pandemic hit us and was cumbersome to our work package, the strengthening took place anyways. So we had to adjust some of our agendas. But we first had a workshop where we settled on 4 topics. And the second workshop we focused on only 1, the risk communication, because then we were in the middle of a crisis, and that was of course when we asked what would you actually like to work on now, the focus was on the topic of risk communication. So that was an online workshop. And then we had a third workshop where we instead focused on 3 capacities that were deemed that they was considered to have strengthened during the pandemic. So once again, by doing a survey with the countries who were involved and interviews, we picked 3 that were the most relevant, and those were surveillance, risk communication, and laboratory capacity. And in the end, the whole thing was evaluated also by work package 3, and the conclusion was that actually to understand what has strengthened during this work package. So the follow-up on this was done partly on the SPAR reports, so that we could compare some actual numbers. If you did that, when we did that, we found that between 2019 and 2020, real-time surveillance increased scores from 70 to 82%. National laboratory systems from a slight increase only, but still an increase. Risk communication quite a bit, from 56 to 63%. And then also chemical events increased, although actually the pandemic was not really about chemical events, so that's interesting. But actually we saw increases, and although we cannot say that they were necessarily because of our work, it still happened a lot. So the conclusions for the work package 1 is that the core capacity is strengthened in 12 countries over the joint action, and that strengthening was linked to the COVID-19 pandemic and the work that was being done anyways. But so we don't know if the result would have been different if the countries had used our tool to actually develop their preparedness in a different way. But nonetheless, we saw an increase, which is what counts. So and the joint action has also prompted the participating countries to revisit and reassess preparedness challenges. Everything becomes much more realistic when there is a crisis, of course, and then money is being channeled to preparedness in a different way. So obviously we got some actual benefits from when it comes to preparedness, from having to work on a real problem. And this also comes to the fourth conclusion, that actually it becomes much more relevant to work on preparedness when you've just been through a crisis. The challenge is then to keep that up once you start the memory starts to fade and things go back to normal and other challenges take place instead. So that was work package 5.1. And the work package 2, then, we have colleagues here who can answer questions. Svein is here with us today, Henriksen, and from the Norwegian Directorate of Health. So, I will present their results, and they focused on international collaboration between authorities during crisis. And the objective was to identify key challenges in this international collaboration. Because there had been challenges before, and there is no real structure for this, or was not at least. So, and to really elaborate on the measures on what are the obligations during crisis? How can cross-sectoral efforts become effective? Are there so that the assistance can be there when needed? During the pandemic, of course, we saw that there was need, but not always very easy to put in place. So this was mainly achieved by a survey that was sent out and to ask questions about international collaboration during crisis, and this was in December last year. And then there was a workshop this spring or in February. So I wasn't there, unfortunately, but Svein was of course there. And though the workshop aimed to gain insight on the new EU legislation, because of course this has changed a lot because of the pandemic. So maybe there is more focus on this now from the EU perspective. So it was important to take that into consideration also. From the Norwegian side, I know there's been the Nordic Public Health Preparedness Agreement that is in place between the Nordic countries already, was put forward as a possible way to arrange something like this. So between the Nordic countries, there is already agreements that can take place. So this promotes the discussion on these topics, and the conclusions was that the suggested template is suggested that can be based on this Nordic agreement, but of course it has to also be in agreement with all the other EU legislation and the mechanisms that are being set up as we speak. So, in addition to the actual agreement, they suggest or propose a body of an international body that can function to work on these topics, to make sure that it's facilitated when it comes to legislation and put agreements in place. So the countries that would sign such an agreement would then, these are just suggestions, but provide assistance upon request, and inform one another when something happens, and also promote cooperation as far as possible when it comes to legislation, etc. And provide maybe exchange opportunities to really integrate this in peacetime as well, and promote and develop cooperation, and also inform one another on relevant changes that happens that can affect the preparedness when legislation is changed, etc. So these are the proposals. And then finally, the task number 3 was a review of EU-level simulation exercises and after-action reviews. And this was done by several people working at the Folkehelseinstituttet in Norway, and it's the Norwegian Institute of Health, according to this one. But yes, so the objective was to see how is it possible to improve results using EU-level simulation exercises and after-action reviews as part of a comprehensive monitoring and evaluation strategy for IHR and the core capacity implementation according to the Decision 1082. So this was done by looking at reports from 17 simulation exercises and 2 interaction reviews, and the analysis of 357 recommendations. So those are the names of the different projects that were analyzed. So the conclusions here was that simulation exercises and after-action reviews are useful to evaluate preparedness on the EU level, as there are no other existing tools to do this. But there is no system in place to monitor and follow up the implementation of these recommendations that come out of these exercises, and that's, of course, something that would be meaningful. And then the comparison of the lessons learned from the COVID-19 found that the recommendations from these exercises that were identified would have actually been good to address and strengthen preparedness for a pandemic. So, this, in the conclusion, the simulation exercise and after-action reviews does provide valuable insight into preparedness that is not currently captured by the SPAR reports or the joint external evaluations. So, and the recommendations then from this work package 3 is that simulation exercises and after-action reviews should be used as an opportunity both to evaluate functionality and to practice response mechanisms. So both for evaluation and practice. And that regional simulation exercises should be designed to target key gaps and challenges based on identified issues. So finding what these, of course, the more specific it is, the more likely it is to address a real problem. And also to consider, to include main lessons and recommendations from these in the reports in the state of preparedness of the EU. And also to that future exercises should include action plans. And this is perhaps the most burning issue, that if we do all these as exercises, how is it actually turned into practice? And without any responsibility for follow-up, then it's likely that nothing may happen as a result. And progress of implementation recommendations should, the suggestion is that this should be in a central exercise repository, so that and that there would also be cost-benefit analysis for carrying out these exercises, so that there would be a database or a repository where you can find all this information in an easy and useful way. So on behalf of all my colleagues, I would like to thank the Work Package 5 countries that have been doing the work, and you have them there. My name is, as you know, Anders Wallensten, if there are any questions, but I think most of these questions can be addressed best during the panel, which will take place after this talk right now. Thank you.